All right, Mr. Smith, let's go ahead and get your fluids started. So your doctor's ordered 0.9% sodium chloride. We call it normal saline. And that's just basically salt water. It's going to help keep you hydrated. Okay? All right. I have my students here with me again. Do you mind if they watch? Thank you, sir. All right, let me get on some gloves. Do you care to tell me your name and date of birth again? Just since I'm giving you some medicine. Okay. And then the students and I are going to talk about some stuff. So the first thing is, anytime that we're giving a patient a medication, we need to make sure that we're doing our medication rights. So we need to make sure we have the right patient, that we have the right drug, that they're giving it at the right dose, at the right time, and that it's the right route. And then at the end, we'll do our documentation, that we do the right documentation. Okay. So we checked our med in the med room. We checked it outside the room. And now we're going to go ahead and check it again here at bedside with Mr. Smith. So with our IV fluids, our order is for 0.9% sodium chloride. We have a liter bag or 1,000 milliliters. Whenever we have IV fluids, anything in a plastic container like this, we want to make sure there's no holes, that it hasn't been poked. We're also going to check the expiration date. We're also going to look for the clarity, make sure it's not cloudy, make sure there's no particles or anything like that in there. If there was, we would dispose of this and get a new bag. So that's our medicine. The other thing I've brought with me is an IV flush, because I'm going to flush this IV just to show you guys what I would do. Now, since we did just start this IV, I know that the IV works because I just flushed it. So I necessarily wouldn't have to do that. And then, of course, I brought my alcohol swabs because I want to clean that hub before I connect anything to it. And then I've got my tubing. I brought a couple of types of tubing that I wanted to show you guys. So we have a pump tubing, and then we have what's known as a straight tubing. Most of the time, you're going to use pump tubing, and everything is going to be on a pump. Unless you work in particular areas like critical care, you may run things on straight tubing. Keep in mind, there are things that can never be run on straight tubing. So vancomycin, any kind of cardiac critical care drugs, potassium, those medications always must be on a pump. Okay, so make sure that you're double checking if you are running something on a straight tubing. Generally, it's only going to be just a normal saline or lactated ringers that you're running on the straight tubing. Okay. All right. So the first thing I'm going to do is I'm going to go ahead and I'm going to check my patient's IV. All right. So I've got my alcohol swab. I've got my flush. Okay. And then I'm going to go ahead and take my cap off my flush and get that air out. I'm going to take the swab cap off. And even though that cap is on there, I'm going to go ahead and scrub the hub for 15 seconds. Because again, the whole point of this is to ensure that I don't transfer bacteria. Okay, and then I'm going to connect my flush. There is a little lock here. If this is locked, just make sure you unlock it, or of course your flush isn't going to go through. So I'm pushing my flush. I'm checking the site to make sure there's no swelling, make sure there's no redness, make sure the patient doesn't complain of pain. And it's flushing great, which we knew it would, right? Because we just put it in. Okay, and then I'm going to go ahead and take my flush loose. So I know my IV works. The next thing I'm going to do is I'm going to set up all of my stuff. So I'm going to grab my tubing and I'm going to open my tubing. So I'm going to demonstrate with the pump tubing, since that's what our patient needs. Since he's just on the regular floor, we are going to put his IV fluids on pump tubing. So when I grab the tubing out of the bag, there's going to be a spike. The spike needs to stay sterile. There's a little loop of tubing that's kind of just held together with paper. I'm going to leave that for now. As I work my way down, I have a port at the top. This top port is where I'm going to put medications that need to run through the pump and can run through the primary. So we call those secondary medications or piggybacks. That's where they're going to be connected to. This portion in the middle I'm going to take this plastic piece off. This portion in the middle is what goes in our IV pump. So our particular IV pump is the Alaris pump. This little box part that sticks out goes into the pump, and then we'll close the door. As we work our way down, we have our clamp. The first thing I want to do when I get any kind of IV tubing out of the bag is I want to actually roll that clamp down so that the tubing is closed. The next thing I want to do is just look, and I have this, again, this little paper thing. It's just looped my tubing together to make it easier for me. So I'm going to leave that. I have another port there closest to where it's going to be connected to the IV. If I need to give the patient a push medication, I'm going to do it here closer to the patient. Okay. All right, so I'm going to go ahead and grab my IV fluids, and what I want to do is the red cap here, I want to pull it off. And then I'm going to leave all my caps on until I'm ready. So my end cap and my spike, these need to stay sterile. So I'm going to leave that end cap on. Now, once I've popped the bag, I'm going to pull my spike cap off, and then I'm going to go ahead and spike the bag. Okay, so I'm holding the bag tight, and then I'm just pushing that in, twisting it. And then once I've done that, again, it's clamped. I've got my end on, so I'm going to go ahead and turn it over as I'm kind of depressing this drip chamber, okay? And then that's going to allow the drip chamber to fill up. So I'm going to grab my IV pump over here, and I'm going to go ahead and stick this on the pole so you can see the little hole in the top of the bag. And I have my pole here, so I'm going to stick that on my bag, or my bag on my pole. Okay, and then I'm just going to raise that up to where I want it. Okay, and then the next thing I need to do is I need to prime the tubing. Okay, so again, I like to leave my paper ties on. I can manage my tubing better. So I've got my drip chamber halfway full. The next thing I'm going to do is I'm just going to hold the end in my hand, and I'm going to unroll very slowly the roller clamp. And what's going to happen is you're going to start to see the fluid kind of roll through. I have my hand on the roller clamp because once it gets to the end down here, I need to close the clamp. Now this is just normal saline, so if a little more than a drop or two comes out, that's perfectly fine. However, if it's other medications, we have to ensure that that doesn't happen. So you can see it's dripping, so I'm going to close the roller clamp. Okay. And then I'm going to go ahead and stick this in my pump. So again, my end's still on, so I'm just going to lay it down. I'm going to grab the top of the blue and the bottom. I'm going to open the door of the pump, and the top blue goes in the little slot, and that box blue goes in where it's blue. There's a little hole. So put that in there, close the door. Okay. Now I'm going to grab my end, and I'm going to release that little piece of paper that's holding it together. And you can see that uncoils my tubing. I'm going to go ahead and grab my alcohol swab. I'm going to scrub that hub again. And then at this point, I'm going to go ahead and take the end off of my tubing and connect that to the end of my J-loop. All right. So once that's connected, I can go ahead and I'm going to unroll my roller clamp, and then I can set my pump accordingly. And then I'm going to document, of course, the medication that I gave the patient, the time, the date, that I checked their IV and that their IV was flushing, that there was no swelling, and that's it. The other type of tubing that we can use for a primary tubing that I mentioned, I just wanted to show you, is the straight tubing. So this tubing looks very similar. It has a spike. It still has that end. These are the two things that we're worried about keeping sterile. We still have our roller clamp. The only thing we don't have is in the middle, we don't have that portion that goes in our pump. Right? So that's why we call it straight tubing. We still have our port at the top. We still have our port at the bottom. Okay. So again, just make sure that you are only using this when indicated, generally for IV fluids, when you're bolusing them in critical care areas. Please never do straight tubing for medications that require a pump.